Good morning. Hello, everyone. Good morning. Welcome.
Buenos días, good morning, ¿cómo están?
Muy bien. We are happy to have you here. Felices de que estén con nosotros. We're gonna give a few minutes just for the other participants to connect with us. Make sure that everybody is in here from the beginning of the presentation. Maybe we're gonna wait 3 to 5 minutes to start the presentation. Thank you, everyone, for being here. In the meantime, could you please put your name, your full name, your role and the organization you work for or collaborate with in the chat? Hello, everyone. We're about to start the training. We're gonna wait just 3 more minutes. And please, in the meantime, could you put your full name, your role and the organization you work for or collaborate with in the chat? Thank you, everyone. Thank you. I'm seeing that all of you are putting your information there. This is very important. If you plan to receive the certificate for later, I'm gonna just ask you to please mute so we can start the presentation. And then if you want to participate with us later, you're welcome to unmute while we have the space for the participation. Thank you everyone for being here. Welcome. We are excited to have you. And we are pleased to have this collaboration with Texas A&M University Center for Community Health and Aging and the CHW Institute for Excellence from ASHA. Go ahead with the next one, please. So it is very important for us to continue to bring important information for the CHW workforce in Arizona and to all our partners, to all our community members. So we are very happy to have you here. To ask you just to break the ice and get to know a little bit about yourself. If you can unmute yourselves and tell us something you're grateful for this morning, something you feel grateful for this morning, and share with us in the chat. I'm grateful for this collaboration. I'm grateful that you joined us for the training. I'm grateful that my dogs didn't make any messes last night in my backyard because they are very high energetic. So I just went to check on them a few minutes ago and everything is fine in my garden. So I'm grateful for that this morning. Anyone else that wants to share, you are welcome to write it in the chat or you can unmute yourself and just open the conversation. Don't be shy. So just to start, my name is Jonata Jaramillo. I'm the director for the CHW Institute of Excellence in ASHA, and I collaborate with team members and other organizations to continue to expand the education opportunities for CHWs and for the community members in Arizona. We're gonna continue with the presenters and tell you that we are very excited to have partnered with the Texas A&M University. And this training has been reviewed and approved by the Arizona Health Department, by the Arizona Department of Health Services for continuing education, and counts as 1 hour of continuing education for CHWs for the recertification process. As you know, in November 7, 2022, the process of the voluntary certification started here in Arizona. And now for some CHWs, it's time to renew the voluntary certification with ADHS. So this information that you're gonna receive is gonna be useful if you wanna accumulate hours of continuing education. So thank you for being here. Please just remember to put your information in the chat so we make sure that you are in our listings to receive the certificate and to have this information as the continuous education for your recertification process. Thank you, everyone. So without further ado, we're gonna present Dr. Matthew Lee Smith. He is with the School of Public Health in Texas A&M University. We are pleased to have him. Can you go to the next slide, please? So he's a professor in the Texas A&M School of Public Health. As an interventionist and evaluator, his research interests around health risks across the life course and evidence-based programming for older adults. His translation, research, and evaluation experience bridge research and practice issues across the healthcare sector, aging services network, and public health system. As a CHW Level 1, Dr. Smil provides educational support to improve community access to needed services and resources. Next one, please. We are also happy to have Brittany Vadillo. She's also with the School of Public Health in Texas A&M University. Next. And she has been with the Texas A&M Center for Community Health and Aging since 2019, right before the pandemic. As a project manager, she works on several projects to improve community health and successful aging. Mrs. Vadillo graduated from Texas A&M University with a Bachelor degree of Science degree in Health in 2014 and a Master Science degree in Health Education in 2016. She's a certified health education specialist and a certified community health worker instructor with a strong background in public health and health education. And she's committed to improving community health and well-being through programs and initiatives. You have the floor. Welcome our presenters, and we are happy to have you, all of you here.
Wonderful. Well, if you all could stop sharing so I could share my screen, that would be tremendous.
Yes.
But it's a pleasure to be here, and thank you so much. Brittany and I just love these opportunities to be able to interact with other community health workers and promotoras, being able to talk about important things like vaccinations. So thank you for that warm introduction and welcome. We look forward to chatting today. So you all can see my screen now? Okay,
yes.
Great. Wonderful. So thank you so much. A little bit about what we're going to talk about today is pneumococcal disease. And so here's our agenda. We're going to talk a little bit about the prevalence and the associated risks of pneumococcal disease. We're also going to talk about pneumococcal vaccinations. So we're going to talk about who is eligible for vaccinations, the different vaccinations that exist, as well as what the CDC recommends for vaccinations for those who are eligible. Then I'm going to turn it over to Brittany, who's going to talk a lot about the myths and misconceptions and barriers to vaccination and some of the strategies that we can use to overcome those barriers, but also to make sure that we can get vaccinations into the hands of the people who need them. And that's really what our primary mission is, which is why we're here today. And again, we just really want to thank and express our value to the Arizona Department of Health Services and the Arizona Community Health Workers Association for having us. So thank you. We do like to start with some disclosures. Neither Brittany nor I are healthcare providers. We're not doctors. So we want to make sure that what we're telling you is what we as community health workers and promotoras should be learning about, what we should be doing in our practice, but we are not doctors. So we want to make sure we have no other conflicts to disclose or conflicts of interest to disclose, but we definitely want to make sure that we acknowledge that part of this education was funded in part by Pfizer vaccines. So let's go ahead and start just a little bit talking about pneumococcal disease. So Streptococcus pneumoniae, or pneumococcus as it's called. We're going to kind of say pneumococcal disease because it's probably easier to say, but this is a bacteria, and this is a bacteria that can be very mild in its presentation or very severe in its presentation. When it's mild, the illnesses can be things like ear infections or sinus infections, but when it becomes more severe, that means that it's infected the upper respiratory tract or the lungs or the blood or even the nervous system. It can cause these blood infections, it can cause meningitis, and it can cause pneumonia. And pneumonia is the most common complication of the severe pneumococcal disease. And with that, it can become very life-threatening if it advances untreated. So, as we know, there are about 4 million cases of pneumococcal infections each and every single year. And about 1.5 million, 1.5 million individuals go to the emergency room each and every year because of having pneumonia. And about 1 in 10 of those individuals who go to the emergency room will actually become hospitalized because of it. And unfortunately, about 3,250 individuals will actually die from meningitis or the associated complications of pneumococcal disease each year. So it is very serious, and it's something that we certainly want to be able to identify and hopefully prevent. Now, one thing that we like to talk about is that anybody can be at risk for pneumococcal disease. It doesn't just affect some individuals, it can affect all individuals. However, there are some of the individuals we know to be at higher risk than others. For example, pneumococcal disease typically impacts those individuals on each side of the life course. So the very young, those individuals, those youth who are ages 0 to 2 years old, but also the older adults who are age 65 and older. Now, in between those two age groups, we also know that adults who have certain chronic conditions or immunocompromising conditions can be at higher risk, not only for contracting pneumococcal disease, but the complications if they get pneumococcal disease. So those individuals with chronic conditions like heart disease, disease of the kidneys, of the lung, of the liver, diabetes, for example, those individuals are at higher risk for getting pneumococcal, but also the complications, as are those who have weakened immune systems or have cerebrospinal fluid leaks or even cochlear implants. Now, also living in congregate communities, so nursing homes, residential facilities where multiple people are under the same roof, it increases the chances of spreading pneumococcal disease, as do intergenerational homes where individuals live not only with themselves, but maybe youth or children who are more likely to get pneumococcal disease and actually carry pneumococcal disease for longer periods than adults. People who smoke and excessively use alcohol are at a higher risk for the complications of pneumococcal disease, as are military personnel, because they're more transient and they live in communal housing, etc. But we're not going to focus on them today. So we know that pneumococcal disease can be transmitted from person to person, and it's usually through a respiratory secretion or droplet spread. That means when you cough, when you sneeze, that's how we spread it. And so that's in your saliva and in your mucus. Now, the issue is that not everybody who gets pneumococcal disease shows the signs and symptoms. Some of these individuals will truly be asymptomatic. So they have none of those. And that doesn't mean that even though those individuals might not have the complications, they might not go to the emergency room or the hospitalization, they can carry the disease without knowing it and spread it to others. So that's why we need to think about how we prevent pneumococcal disease in ways that we can protect everybody around us. Now, when we talk about the symptoms, so what is it that we typically see? It almost looks like flu-like symptoms in many ways, where the person has a fever, they have chills, they're sweating, they're very tired or fatigued, but also they'll have a wet cough or a cough with phlegm, not that dry, very wheezy cough. It's more of a wet cough that you can hear, and you can hear more fluid in the lungs. But that can also be associated with rapid breathing or difficulty breathing or even chest pains, which is why individuals will end up going to the emergency room or going into the hospital. Now, when we think about the hospitalizations for these individuals, if you compare people from 18 to 49 years of age, those who are 50 to 64 are 6 times more likely to be hospitalized because of pneumococcal disease than those younger individuals. And those who are 65 and older are 10 times more likely to be hospitalized compared to those who are 18 to 49. So There certainly is a higher risk with age, which is why we certainly want to protect each other and one another. And the only way, and the best thing to do is that we want to be able to identify pneumococcal disease early and start some form of treatment. And that's usually to be able to identify and diagnose it. It starts in a physical exam by a healthcare professional. So this isn't something we as community health workers or promoters are going to do. This is something that a healthcare professional would do. And the ways of doing this are pretty simple: a urine test, so non-invasive, but also if it's more severe, they might do a cerebrospinal fluid test or a blood test. But usually a urine test would be sufficient. Once they identify that it is pneumococcal disease, they'll usually start a broad span of antibiotics until they identify what true form of pneumococcal disease they have, and then they'll do a more tailored. So broad spectrum and then maybe more, but antibiotics is typically the way that it's treated. But the one good news that we have is we can prevent them. And the best way to prevent pneumococcal disease, other than washing your hands and avoiding the droplet spread and the coughs and covering our mouths, is through vaccination. And so we're going to talk a little bit about vaccination, its eligibility, and additionally, what the CDC recommends for vaccination. So pneumococcal vaccination has two different forms. The forms of vaccines are either a conjugate vaccination or a polysaccharide vaccination. Now, without getting into too much detail, a conjugate takes a small piece of the bacteria that's dead and introduces it as part of the vaccine so that the body's immune system starts to develop a response. It starts to recognize it. It starts to create antibodies. So then if you were ever infected, your body recognizes it and can fight it away. A polysaccharide is where they take parts of the vaccine. The vaccine includes elements to look like the bacteria's surface so that your body can start to recognize it and again form an antibody response. So one of them is actually a small part, a protein of the bacteria to help your body understand it. The other one is made to look like the surface of that bacteria so that your body starts to recognize it. Both of them have their advantages, and both of them used to be recommended that they're used together. You get one conjugate and one polysaccharide, but we'll talk about that in a bit. The point is that out of those, there are 4 known safe and effective vaccines that are approved by the CDC to prevent pneumococcal disease. 3 of those are conjugate. 1 of those is a polysaccharide. Now, here these are listed out for you. It's not as important to know which one is which because, again, we just need to better understand if individuals are vaccinated, if they're eligible for vaccination, and whether or not we should recommend that they get vaccinated and help them get to their healthcare providers so that they can do so. But we do want to make sure that everyone understands that there are 4 different ones, and that we'll talk a little bit about the eligibility here in a minute, where you can see how they're recommended for individuals of different age groups and whether or not they have chronic conditions. As mentioned before, these vaccinations are really important for people who are ages 65 and older, who have those certain chronic conditions, whether they be those chronic conditions, immunocompromising conditions, whether they have regular interactions with youth or children, and also if they live in areas where not a lot of people are being vaccinated. If their area doesn't have a lot of vaccinated individuals, then that herd immunity isn't really being optimized. It's not really occurring. So what ends up happening is more and more people can have pneumococcal disease and therefore spread it to others. So we really want to concentrate on those areas and those individuals. So there are 2 entities that regulate vaccines. This one is the Centers for Disease Control and Prevention, and the other is the Advisory Committee on Immunization Practices, which is within the Centers for Disease Control. So the CDC, that's a National Public Health Institute. It's a federal agency. And what it does is it provides guidance about how and which vaccinations we use to protect the general population from vaccine preventable diseases. The ACIP, which is within the CDC, is made up of medical and public health professionals. And what they do is develop the recommendations about how we use those vaccinations and who should get them and when. So the schedule. And that's for the civilian population. Again, remember, the military is a little different. This is those of us not in the military, living in society. So the CDC and the ACIP make their recommendations. They also work with other entities like the Food and Drug Administration. And then, of course, they publish their findings so that everybody can know what the recommendations for the schedules are for different individuals. So that is what their role is. The recommendations for pneumococcal vaccine say that every individual age 65 and older should be vaccinated, every single one. So that's the recommendation, because we know individuals 65 and older are at higher risk for the pneumococcal disease, hospitalizations, but also the other complications like pneumonia. In addition to that, like mentioned, those who are 19 to 64 with certain chronic conditions and immunocompromising conditions should be vaccinated. So again, that is those who have things like diabetes, certain types of heart disease, liver disease, lung disease, sickle cell anemia, organ transplants, certain types of cancers, HIV, and then, of course, those who smoke and those who drink excessively. So there's a lot of those. And then, of course, the immunocompromising ones are marked here. But there are many different groups. So this is what, when we interact with our clients, we need to better understand about them. What age are they? And then, of course, if they're age 65 and older, we recommend that they get the vaccine. But if they're 19 to 64, we want to know a little bit more if they have any of these kinds of conditions, because that's who we would recommend get the vaccine. Now, this will get a little complicated, so I'm going to keep it as simple as I can, because, again, we just want you to better understand a little bit about who's recommended to get the vaccines and which ones you should get. But remember, we're not healthcare providers. We're instead making the linkage to individuals to get to healthcare providers so that they can do a more formal assessment and actually give the vaccines. We don't give the vaccines. We just want to gather the information and make the recommendation, make the referral, make the linkage. So the CDC has made this actually pretty easy for us, even though it can be very complicated. So if you're age 65 and older, on the left-hand side, it says, have you had any of these prior vaccines for pneumococcal disease? So you can say that you've had none of these vaccines before. Maybe you got one of the polysaccharide vaccines. Maybe you got one of the conjugate vaccines. Maybe you got one of already each. When we go into an individual's home, we might learn that they've already had some vaccinations, but we don't necessarily know. So we want to find that out. Now, in this option, you can see that if you've had no vaccines or you've had some vaccines, then now you can go ahead and just get one of the conjugate vaccines, the PCV20, and you can be done, considered complete, that you don't have to get any more pneumococcal vaccinations after age 65. Now, option B is a little more complicated because, again, if you've never had a vaccine, in that top row, you would start off with a conjugate and then a year later get the polysaccharide. But if you've already gotten the polysaccharide, you wait a year and then you get the conjugate. And if you've already, okay, you can see it gets a little complicated. So that's why we kind of like option A. It doesn't really matter where you've started. They've now advanced the vaccinations so that you can just get one, be done, and that's all. Now, one of the things to consider is that after age 65, if you've already gotten your vaccines and it's already been 5 or more years since you've gotten those vaccines after turning 65, you can do what they call shared clinical decision making. You can have the patient talk to their provider And with that, be able to have a conversation about whether or not they should get an additional level of protection. So another dose 5 years or longer after turning age 65. And again, that's that shared clinical decision making. And that's something we're great at as community health workers and promotoras, is that we really can help provide the information to the client to make sure that they know what questions to ask, what they should recommend, what they should consider when they talk to their healthcare providers. So it's really great. Now, if your ages 19 to 64 and you have one of those chronic conditions or immunocompromising conditions, you can see option A again makes it pretty simple. Regardless if you've ever gotten another vaccine before, you can just get PCV20 or one of these conjugates and be done. Or as an alternative, you can see the complexities where, okay, you could say, well, you get one, you wait about 8 weeks, you get another, you get a different one. If you've already had it, you can wait a bit of time. You can see. So we like to focus on option A because we know that it's very much easier for individuals to go in and get one vaccine than to do this scheduling sequence where they might not follow through and complete the cycle for full protection. So this is where we're looking, is more of that option A. And remember, again, this isn't exactly for us to do. It's more of us to understand and recommend what they should do to follow up with their healthcare providers. Following on that same vein, for those who have a cochlear implant or cerebral spinal fluid leak, option A seems to make most sense. So with that said, one of the things, right now, as we're in what we consider flu season or respiratory season, because people are getting sick, they're coughing, they're sneezing, they have runny noses, and we know that that can contribute to the pneumococcal disease spread. Well, the thing about it is oftentimes people will recommend pneumococcal vaccinations during flu season, but it's not just for flu season. These can be administered at any time during the year. So this protection can be any time. It doesn't usually have to be right when we do the flu vaccines. But it's a great time to promote because everyone's thinking about it. And if they're going to go somewhere and get one of the vaccines, they might as well get multiple of them. We like to stress that always a healthcare provider should be the one giving this vaccine. And so we are not the ones giving vaccinations. We're the ones making sure that the healthcare providers are providing and giving those vaccines. And if we don't know what their eligibility is, we go ahead and just make sure that those healthcare providers will ask the questions and make a clinical decision with the client about what's best for them. But for us, if we want to determine a little bit about their eligibility and ask some questions so that we know what kind of recommendations to give, we can do that. And what we need to learn are these 6 things. 1, how old are they? Because as we know, if they're over 65, we recommend it. If they're in another certain age group, we ask some follow-up questions. Do you have any health conditions or those immunocompromised conditions in that big old list? And say, do you have any of these? Are these things that you have? Are you taking any medications that might suppress your immune function? Because remember, the reason why we're recommending the vaccines is because people who have certain conditions or suppressed immune systems are more susceptible to getting the disease complications that can cause the pneumonia, the hospitalizations, and the other consequences. We ask about the smoking history and maybe some drinking history, as well as who they live with, or if they interact frequently with youth. Because like we said, those congregate living situations or intergenerational living situations are things of risk that we need to understand. And then we ask them which of the vaccinations that we've gotten and ask them if they've ever had any of those, etc. So with that said, this link here can link you to a little online test that you can use with your clients and just click on through and it will kind of tell you what to recommend. So that's a nice little tool. Now, when we talk about the vaccinations and where they are, the pneumococcal vaccinations are available in many different places in our community. The most being, of course, healthcare providers. So in a clinical setting, whether it's a pediatrician, a family doctor, a geriatrician, they typically have the pneumococcal vaccinations. But also the other community health clinics like FQHCs, et cetera, might also have them. So they're usually very prevalent. When we think about our county health departments or any of the other public health departments, they might also have pneumococcal vaccinations that they can give out. Pharmacies like CVS or Walgreens or any of the others might also have these vaccinations available. And then sometimes, depending, there might be, a vaccination drive or some other event to promote vaccines that can occur at universities or schools or faith-based organizations or workplaces, wherever those might be. So the healthcare providers are the ones who typically have them. And then, of course, the county health departments as well. But if in fact they don't, you can always ask them, well, who do they recommend? Or where do they think their clients or their patients can get these pneumococcal vaccinations? One thing we can do is do a little research and ask these questions of where the pneumococcal vaccine is available, what the eligibility is for getting them in terms of financial cost or getting them covered. And that way we know this before we speak with our clients so that if we make the recommendations, we can link them to a location. Now, in Arizona, the Arizona Department of Health Services provides information about where people can get vaccinated. And here's this great link. So this is here for your local area. Now, with all of that said, I'm going to go ahead and turn this over to Brittany to continue talking about the misconceptions and barriers.
Yeah, so now we're gonna, like Matthew said, we're gonna go ahead and go over some common misconceptions and barriers to pneumococcal vaccination. So some common misconceptions, there are several misconceptions, concerns, barriers that might prevent adults from getting vaccinated against pneumococcal pneumonia. One common misconception is that people might think that they're too healthy to be at risk for pneumococcal disease or that they just don't need the vaccine. Another misconception is that the disease will make their immune system stronger. And both of these beliefs are false. So if your client that you're working with makes these comments during a conversation, and if they are 65 or older, just make sure to clarify that the CDC and the ACIP recommend all adults age 65 and older be vaccinated against pneumococcal disease. Pneumococcal vaccinations are especially recommended for clients with risk factors such as certain chronic conditions, as Matthew mentioned earlier, also those having regular interactions with youth and those residing in areas with low vaccine uptake. Also reinforce that pneumococcal disease can be passed from person to person and that the risk of pneumococcal pneumonia hospitalization is 10 times greater for adults age 65 and older compared to adults aged 18 to 49. So here are some more common misconceptions about the pneumococcal pneumonia vaccination. So some adults may share concerns about vaccine safety. If these concerns come up, just reinforce that pneumococcal vaccines are safe. In the US, all vaccines undergo rigorous trials and testings before they are made available to the public. The ACIP is a committee within the CDC made up of medical and public health experts. Their role is to develop recommendations about the youth of vaccinations for the US, and the ACIP recommends the pneumococcal vaccine for all adults age 65 and older, as well as adults age 18 to 64 who meet those eligibility criteria that Matthew had went over earlier. Some may say that getting vaccinated is painful. And while many people typically don't like needles, the pain of the injection itself is typically minimal, might feel like a pinprick followed by slight discomfort while the vaccine enters the body, and just, reassure them that the pain should be minimal and short-lived. Some also may say that the vaccine has awful side effects. So after getting the vaccine, some possible side effects include redness or tenderness at the injection site, low-grade fever, irritability, feeling tired, headache, chills, loss of appetite. These mild problems should not outweigh the benefits of being vaccinated. And when talking with an adult, it is important to just be honest with them about the side effects, but also highlight that not all people who get the vaccine experience these side effects, and that if they do, most are mild and subside pretty quickly. And another common misconception is that some think that they will get the pneumococcal disease from the vaccine. The pneumococcal vaccine cannot give you pneumonia, although some vaccines may contain a version of the living virus or bacteria that have been weakened. Pneumococcal vaccines do not contain live bacteria. And years of research, trials, and testing have confirmed that a person cannot get pneumococcal disease from receiving the pneumococcal vaccination. So now we're going to go over some common barriers to pneumococcal vaccination. So some adults, they just may not know what vaccinations are recommended for them. So it's important to educate them about the vaccination schedule for their age group. If they are age 65 or older, this barrier can be most effectively addressed by reinforcing the recommendation that all adults age 65 and older should be vaccinated against pneumococcal disease. You can encourage them to speak with their healthcare provider about getting vaccinated. Individuals are more likely to get vaccinated if their physician recommends them to. So sharing the facts with the adults and just answering their questions will also help them engage in productive conversations with healthcare providers and just take an active role in making clinical decisions. Another barrier is that some may say the vaccination is too expensive. So financial barriers ultimately lead to lower immunization rates as well as lower healthcare utilization just in general. So they may believe that vaccines are expensive and they're not covered by their insurance. They may also not know the details about all of the health insurance coverage or what services can access based on their coverage. So just reinforce that the pneumococcal vaccine is typically covered under most health insurance plans. However, exact costs will depend on the person's insurance coverage, and that can vary. Most Medicaid agencies cover adult immunizations. However, some may not offer some vaccines. So just contacting your local branch or provider is recommended to determine availability. And there's other local agencies and programs might exist to offer free or low vaccinations for those uninsured and underinsured adults. Another barrier is limited access to healthcare and health services. So you should just recognize that some adults may live alone, they may lack a supportive social network of family and friends, or they may not have transportation to see a healthcare provider. So when they have they have difficulty getting from place to place, you should just be prepared to offer transportation services to them. So I'll make them aware of the different options so you can help them explore their social network, see if there might be a trusted, reliable person that can give them a ride. You can also see if there's any non-emergency medical transportation services in the area. You can also, just investigate, see if there might be public transportation vouchers or waivers available to them in their area. And lastly, you can explore the option of using a rideshare company such as Uber or Lyft, but only suggest the rideshare company if the client feels comfortable and then also they can have the ability to pay for this service. So another barrier is that the adult and their doctor don't speak the same language. So as we know, communication barriers make interactions with healthcare providers much more challenging. These barriers may create challenges for adults to understand the information being told to them by healthcare professionals, and may also create challenges for the client to convey their messages, including their preferences as well as their concerns. So in addition to providing information in the preferred language of the adult, your role may also be to facilitate communication on their behalf or to coordinate with family members or other individuals to support them during the visit and their visits with the healthcare providers. So next, we're going to go over some strategies to engage adults for action. So for adults, healthcare can be emotionally charged and cause possible feelings of fear, anxiety, frustration, and uncertainty, especially for those old adults or those with one or more chronic conditions. So these are some strategies for speaking to adults about their healthcare concerns. So first, you want to always allow extra time. Conversations about healthcare are likely to be longer than you expect, so anticipate plenty of questions. Adults can be quite thorough and they may not always know all the details about their healthcare needs or their healthcare coverage or options available to them. Also, just try to stick to one topic at a time, keep the conversation simple, and be sure to conclude the discussion about a particular topic before moving on to the next issue. You also want to use short and simple words and sentences. Avoid using too much technical jargon or sophisticated phrases so that the adult can understand your messages and the points you're trying to get across. Also, feel free to confirm that they understand what is being talked about and be prepared to repeat the message or to describe it in a different way. Also, simplify and write down any instructions. So if you're giving instructions or describing processes to an adult, it's helpful to write them down on a list. Making a list is always helpful to keep the conversation productive and make sure that all the topics are covered. A checklist used during conversation can also be provided after the discussion as a way of reinforcing those messages and instructing them about their next steps. It's also helpful to use charts and pictures when possible. Using pictures can help you get points across more quickly, especially for the topics that are more complex or abstract. Lastly, give adults an opportunity to ask any questions and to express themselves. So because the conversation you're having is about them and their health and wellness, their options, preferences, and concerns are always most important. You want to avoid making them feel rushed. So while planning your visit, just be sure to always build in extra time to make sure that they can ask any questions that they have or that their family members may have as well. So motivating adults to take action. So one of our key objectives when visiting with older adults, their families, and their caregivers is to motivate them to take action. There are many strategies we can use to motivate them to receive the pneumococcal pneumonia vaccinations, and these same strategies can also be used to motivate their family members as well as their caregivers. So first, you want to share recommendations from healthcare providers and other authoritative agencies like the CDC and ACIP. Adults are more likely to get vaccinations if their doctor has recommended those to them. Also want to highlight that being vaccinated can protect them and their others around them. So for older adults, just reinforce that children and young adults want to protect their grandparents from pneumococcal disease in the same way that grandparents want to protect their grandchildren from the disease. You also want to be sure to spend enough time discussing the importance of getting the recommended vaccination. So if the adult does not recognize the importance or maybe seems resistant or hesitant, just maybe try to encourage their family member or caregiver to explain it in a different way that they will understand. You also want to share facts and statistics that they can relate to. So be sure to select this information carefully and share it in a simple way to avoid any confusion. You also want to craft useful vaccination messages. So always avoid using any fear tactics, and you want to highlight the positive reasons to get vaccinated. And just again, reinforce that one simple action is enough to protect them as well as their loved ones. You also want to highlight the positive experiences of others. So having examples or testimonials of others who have been vaccinated may help them think more positively about getting their vaccination. And lastly, just make specific recommendations for the next step. So clearly listing those next steps with relative information, such as the location and contact information of vaccine providers, that can definitely help motivate clients as well as their families and caregivers to get vaccinated. So being a vaccine champion, anyone can be a vaccine champion. A vaccine champion is someone who supports vaccinations and tries to protect people by improving vaccination rates. Vaccine champions can be healthcare professionals, social workers, clinicians, community health advocates, such as community health workers and promotoras. So specifically, vaccine champions should know about pneumococcal disease and be able to understand the causes, symptoms, and the ways in which pneumococcal disease spreads. They should also be familiar with ACIP recommendations, so just with those vaccine guidelines, as well as vaccination best practices, so just learning about the procedures as well as the schedules based on the specific age. They should also be aware of available resources to provide vaccines to those without proper insurance coverage. So just letting them know where they can go to get vaccines, as well as effective communication, developing strategies to communicate and motivating adults for vaccination. They should also facilitate productive conversations between adults and their healthcare professionals to empower informed vaccination decisions. And they should also be reporting the vaccination. So recommend that the healthcare providers report these administered vaccines to state or local registries, such as the Arizona State Immunization Information System. And here are some helpful resources. We can put these in the chat, but we can also share these with you after the webinar as well. And now I'm going to pass it back on to Matthew to go over some resources.
Thank you so much, Brittany. So as you can see, we've talked a bit about the pneumococcal disease, a bit about the vaccination recommendations, about some of the myth and misconceptions that exist out there, some of the barriers, and of course, what we can do as community health workers and promotores to be able to motivate for action. So with that, the presentation that we just gave is actually a subset of longer trainings that are totally free of charge. And you can get 2 continuing education units for them. One is about pneumococcal vaccinations for adults. With this, it covers much of what we just discussed, but goes into greater detail and has wonderful resources that you can download and use during your during your interactions with clients. But in addition to that, we have on the left-hand side, on the right-hand side, we have the training for vaccine preventable diseases for youth. And this is one, again, that talks a little bit about the various vaccine preventable diseases that are available for youth, the vaccines that are recommended at what timelines and the schedules, and what to do if you've missed the schedule, so you're off schedule. So it's a great training generally for youth, because as you know, we treat the entire household, not just certain populations. Each of these comes with a downloadable toolkit, and the way we designed the toolkit there's things that you can read or have yourself review to become familiar in preparation with your visit with a client. You can use it during your visit with a client, and then you can leave things behind with your client so that they can use them. So those checklists, those graphics, those information sheets, the things Brittany was talking about, we've created many of those so that you could access those. So these are the trainings. I've talked about this long enough, but I think they're both available in English and Spanish, available for continuing education units. Please tell everybody, completely free. And with that, we conclude and still hopefully have about 10 minutes for question and answer.
Thank you so much, Brittany and Dr. Smith. This information is wonderful and so relevant for our community health workers and all the community members in Arizona. Please go in the chat or unmute yourself if you have any questions. The space is yours. Richard, could you please start reading the comments? I think there is a few comments in the chat.
Yeah. So Carmen from La Paz County said, Mr. Smith, you're an expert on this topic. I love the data, especially knowing that anybody can get pneumococcal disease. I love learning about the higher risk for those that with weak immune systems. This info is extremely helpful. I care for my 91-year-old mom, and our team works with the older population. Thank you.
Great. Thank you for that.
And then William Wallace said, some organizations offer homebound vaccination services where the practitioner come to the patient's home. Call your health department about this.
Yes,
And
and
then,
I received a message, a direct message asking me if this video of the training will be available for further review, because that person was saying that she would like to go deeper into the topic. Obviously, now that you provided the slides with the information, they can go and review that information, as well as can access the video, so they can have an overview before they go over there or after, so they can remember the main topics or the main points of the presentation. So this video is going to be uploaded into the ASHA website, and you're going to have access to that. You just give us your contact information in case you would like to receive a certificate for the training. That once you review the video, we will just ask you to answer a few questions, like a little evaluation, that we can have that on records, and you can have this information as part of the 1 hour continuous education for your recertification with ADHS. Any other questions that you have? We are happy to hear you. We have a few minutes, so unmute yourself and tell Dr. Smith and Brittany whatever you want to tell them about your concerns or your observations or any other comments.
Hello, my name is Vicky, Virginia. I really love the presentation, but I missed a few parts at the beginning because I was having problems with my phone. So this information that you just said you will provide for us, are you gonna email to us, or how is that gonna work? Because I definitely wanna learn more and get the certification that you just said.
Yes, yes, of course. So the way the process works, usually we advertise on our social media, all platforms, Facebook, Instagram, Twitter, when a new resource or training has been uploaded into the website. And we provide a link so you can connect directly with the website so you can download the video. Once you are in the website, you can give us your contact information and you would like to receive the certificate for the continuous education. And then we send you that certificate once you complete the evaluation after you review the video. That's the way the process works.
Oh, I'm sorry, it's me again. But what if I don't have any of those social media?
Okay, if you don't have any other social media app, you can go directly into the website and the ASHA website. Christina, could you please put the link for the ASHA website on the chat so everybody can save the link? You can go directly there and you can access the video and follow the steps once you register your information, and then once you receive the link for the evaluation.
Awesome,
So
thank you so much.
Yes, if you have an email, you're gonna be able to access the video.
and then there is a chat message. Patricia asked, can you repeat how to get the certificate? Thank you.
Yes, of course. So this training is gonna be uploaded into ASHA's website. Usually we promote all the new resources that we have on our website, on our social media. If you don't have social media, no problem. You can go directly into the link that our team members are gonna put in the chat for our website. And once the training is available, you're gonna be able to provide us with your contact information to download the video. And once we have your contact information, you're gonna be sent a link for the evaluation. If you would like to receive the certificate, you will need to complete the evaluation. You will receive the certificate, and they will be noted that this is this can be used for continuous education for the certification or recertification ADHS.
I have a question.
Go ahead.
I was just wondering, I saw that the cochlear implant was also a factor. How is that? I couldn't connect it together. So if you can explain that.
So interestingly, and again, the caveat of we are not physicians, so the exact mechanisms I'm not going to be able to speak to. However, as you know, part of your ear is part of your respiratory system and many of the different sinuses. And because this is a respiratory infection and can create additional mucus, etc., there can be complications.
Okay. And that's because it's all in the sinus cavity. That's what I thought, but I wasn't too sure if that was
Yeah.
the connection. Okay, well,
No,
thank you.
great question.
Well,
Great question.
yeah, thank you.
And then I also see that Nancy put something in the chat that said, what would happen if an older person can't remember if they've been vaccinated and gets another shot? Well, this is something where the reason why we don't provide vaccines and instead we tell all of our clients that they have to go to healthcare professionals and they can only be vaccinated by healthcare professionals is because they're going to do their own forms of screening. If an individual can't remember their vaccination history, they don't know their eligibility, they don't remember exactly what they've been vaccinated for, they will go and the healthcare provider will make a determination. Maybe wait a little more time, give a vaccination. Remember, we have option A and option B and all these other things. The complexities of that, they have protocol. The key for us is to make sure that we identify enough of that information or the fact that there's a lack of information and make sure that they go speak to somebody and we make that linkage for them.
Thank you. Any other questions? Richard, could you please check the chat just to make sure there is no questions there?
Yeah, there's no questions. Emily just said vaccine records should be uploaded to the state health department database that can be requested if they have lived in another state prior. They will have to request from that state directly.
Great, thank you. Well, thank you so much, everyone. We were so happy to have you here. We hope this information is useful for you and your communities. Please, before you go, remember to put your contact information in the chat if you would like to receive the link for the evaluation. That way you can process the certificate and get those continuing educations for the recertification through ADHS. So put your contact information there, the organization you work for, and that will be very important to follow up with you. Thank you, everyone. Thank you, Dr. Smith. Thank you, Brittany. This was wonderful.
Thank you. We really appreciate it.
Well, give some love to the presenters in the chat, and we hope to see you in our next training. So just remember to follow us on our social media so you can keep up to date with new resources. This information is gonna be provided, these QR codes are gonna be provided on our social media as well. That way you can have access there in case you are not able to save them right now or to link to those resources. Please just follow us in our social media so you can know what is coming in the ASHA Institute of Excellence in the training center. So thank you so much for being here.
Thank you.